There's a new CDC study that shows the number of children being diagnosed with autism appears to be increasing in communities around the U.S. Health and Human Service Secretary Robert F. Kennedy Jr. called autism an epidemic yesterday, but these new findings suggest other factors may be at play. Joining us now is Dr. Zachary Warren, a co-author of that report. He's also a professor of pediatrics at Vanderbilt University and executive director of the Vanderbilt Kennedy Center's Triad Autism Institute. Thanks so much for joining us, Doctor. Can you tell us about the scope of this study and what stood out to you as to the information that you gathered in compiling this report?
Yeah, absolutely. So the Autism and Developmental Disabilities sort of Monitoring Network, or ADAM as we call it, examines medical and educational records across a number of communities in the nation to document the number and characteristics of children with autism. And specifically in this particular study, we looked across 16 different communities in the U.S., had children who are 4 and 8 years of age in 2022. And, you know, without question or controversy, this work really highlights, in the end of the day, how unbelievably common autism is in our communities. Here in Tennessee, we've eclipsed 3%. There are some communities in the U.S. that are now over 5% in terms of prevalence, and really kind of highlights, because this is so common, that we really need to think about pushing to build effective and efficient systems of care capable of serving 3 to 5% of kids in our country.
Doctor, I have a question, and this comes from a position of ignorance since I'm not a doctor and I'm not a scientist, but the spike and the increase in autism diagnoses, is that because we think that there are more children that are autistic, or is it that I was born in the 1960s, grew up in the 1970s. I don't recall anybody knowing anybody that was autistic as a child or even up into my teenage and college years. Perhaps it was still there and we just didn't know, and doctors didn't know what it looked like or what it was.
Yeah, it's a terrific question, the one that hyper-intelligent and caring people ask when they see these increases over time. And in Tennessee and the nation, we've certainly seen changes related to increased awareness. We've changed diagnostic practices. We've changed diagnostic criteria. We've broadened what we think of in terms of the autism spectrum. And also, we've gotten much better at conducting these prevalence studies themselves. Without a doubt, this ADAM network has become exceptionally efficient in this work to more accurately count and find children who might not have been counted or found decades ago. There are also other likely complicated factors related to population health, things like prematurity, differences in parental age, intervals between pregnancy, complex prenatal exposures, malnutrition, infection, other health factors that could be at play in seeing a true increase. But it's really not the answer that this particular study gives.
All right, Dr. Zachary Warren, thanks for joining us today.
You're welcome. Thank you.